We are delivering millions of these rapid antigen tests across the state. So many of our testing sites have RATs available for those who need a rapid antigen test. We are handing out literally hundreds of thousands of these. And Jerome may be able to speak in more detail about some of the trends in recent days, but I'm very pleased to think that there are, on any given day, 40, 50, 60,000 people, perhaps more even, who are getting a rapid antigen test free from a testing hub, and that's about cutting off chains of transmission. When you combine that with people isolating, making that sacrifice, making that important contribution, that's how we limit or at least impact the number of cases that we have across the community. And what we know is a percentage of the total number of cases will finish up in hospital. So if we have less total cases, we finish up with less people putting pressure on our health system through no fault of their own. That's just the way this works. We don't have as many people in ICU as you might have expected if this was a Delta outbreak that had got away this much. That's the nature of this new variant. Not mild, but milder than Delta. The vaccines are still working as a protection against critical illness in the vast majority of cases. That's great news. But infectivity, the attack rate of this, the transmission rate of this virus, this new Omicron variant is so high that the only thing we can do is get a third dose. We call it a booster. It's not really a booster. It's certainly not a bonus. It's critically important. 3 doses is what is needed. And then, of course, to isolate and play your part when you're called upon to do that. We're grateful, it's so important, and it is making a big difference. As we see some stability come to these numbers in recent weeks. Now, I just wanted to speak briefly in relation to announcements that the Acting Minister for Health has made today. We spoke about IVF services yesterday, and I made it very clear to you that no one's pleased to have to turn off or pause any services across our health system. But Co-Brown and the extraordinary and unique pressure that our system is under, and again I stress that's not because of money or the lack of machines we need or PPE or equipment, it's about people. And when you have literally 4, 5, 6,000 people who on any given day would be working in our health system but aren't because of COVID, that puts extraordinary pressure. So decisions were made based on advice. It's now appropriate to have another look in the context of things as they are unfolding, to kind of start with a worst case position and then try and reinstate whatever you can. I'm very pleased that the public health team, the Chief Health Officer, has reviewed his advice and the Minister's accepted that and been able to make a new decision under the new Act to reinstate IVF services. That'll take a couple of days. But those who are already in the system were still receiving, mid-cycle for instance, they were still receiving IVF services. It was about not having new patients come into that system. They'll be able to come into that system from early next week, and the orders will be effective immediately, and that is a very good outcome. I apologise for any distress, for any concern. It's never easy. It's never easy in such challenging times, and I just want everyone to know across the community, everyone's doing their very best just to keep people safe. That's what drives us. That's what everyone who's providing advice to the government is driven by, one thing and one thing only: to try and do everything they can to keep Victorians safe. But I do apologise for any sense of distress or pain out of this, but it's great to be able to have those services back on. And I thank the public health team for reviewing their advice, for changing their advice, and of course for the Acting Minister for Health for having made the decision he's made.